Hello, my name is Edison Alfredo Tomalaparra. My topic is Coronary Artery Occlusion from Kawasaki design. Definition. Kawasaki design is a design in which there is inflammation of the blood vessels. It is usually diagnosed in young children under the age of 5, but older children and adults can also have this disease. The main complication of Kawasaki disease is coronary artery aneurysm, which can lead to heart attack and ischemia. Application in nurse. All children should be treated as soon as the diagnosis is made, even if they don't know have all the symptoms. The recommended initial treatment is with intravenous immunoglobulin given at 1/4, 8 to 12 hours and aspirin. Next, we will see a video.
Here at Brenner Children's Hospital, we probably treat 2 to 3 patients per month for Kawasaki disease, so it is more common than people think. And the signs and symptoms to look for have been carefully outlined by the American Heart Association, and it is fever for at least 5 days. And then there are 5 other criteria we look at, and that is the whites of the eyes become bloodshot, the lips become dry and cracked and red, there may be lymph nodes in the front of the neck that become swollen, the hands and feet can become swollen, and the palms and soles can become red. And then the last one is rash. And we look for 4 of those other 5 criteria: changes in the eyes, mouth, the neck, the hands and feet, and the rash, along with the fever for at least 5 days, to say this may well be Kawasaki disease. There are some patients who don't have that, which is called complete Kawasaki disease. There are some patients who don't have all those criteria, don't have 4 of the 5, and we call those atypical or incomplete Kawasaki disease. And it's important that those patients be diagnosed as well, because incomplete Kawasaki disease can lead to complications just like complete Kawasaki disease can.
Pros and cons. Pros: it is a curable disease, and if it is cured at in the time, it is not fatal. Cons: can have a fever that lasts at least 5 days, red eye, a rash on the left mouth, hands and feet that are snow and red. Next, we will see a video.
The treatment for Kawasaki disease is high-dose gamma globulin, which is given through an IV, and aspirin. And the purpose of the treatment is to prevent the likelihood that Kawasaki disease will leave behind any complications in the heart. And the complications it can leave behind are the blood vessels that supply blood to the heart. The coronary arteries can become enlarged. They become like aneurysms. And that's the complication that's very important to be aware for Kawasaki disease. The purpose of the treatment is to prevent that complication. The fever and all the other symptoms will go away with or without any kind of treatment. Just like any other febrile illness, they'll go away with or without any other treatment, often does. But the purpose of the treatment, the gamma globulin and the aspirin, is to decrease the likelihood of having the complications in the heart that can be left behind. Without treatment, overall about 20 to 25% of patients who have Kawasaki disease will have those complications in the heart. With the treatment that I described, we can decrease the rate of complications down to about 3 to 5%. So it is very, very important that Kawasaki disease be considered in patients who might have it, and then in fact treated if it's thought that they may well have Kawasaki disease.
Issue applied in Ecuador. In Ecuador, Kawasaki disease is one type of rare or orphan disease defined by the Minister of Public Health. Therefore, the statistic that of the disease do not present an adequate prevention. Conclusion. In conclusion, Kawasaki disease is the inflammation of the blood vessels that children under 5 years of age generally present, but older children and adults may also have this disease. They may have a fever that lasts for at least 5 days, redness of the edges, rash on the lap, mouth, hands, and feet swollen and red. Also present coronary artery aneurysm that can lead to myocardial infarction. Thank you.